Lecture 3, Tobacco and Your Body. It's a damage from head to toe. The title is Tobacco and Your Body, Damage from Head to Toe. Namaskar, I am Dr. Rajendra Nanavre, chest physician and public health educator. Welcome to Lecture 3 in our World No Tobacco Day Awareness Series. We have already covered the impact of tobacco and its many forms. We will explore now how tobacco affects nearly every organ of the human body. It is from head to toe. Many people think tobacco just harm the lungs and the mouth, but in reality it affects almost every system, including the brain, heart, blood vessels, reproductive organs, skin, bones, and many more. Let's go step by step. So the first is the brain and mental health. Tobacco delivers nicotine which rapidly reaches brain. It creates addiction by activating the reward center, making quitting difficult. Long-term use increase the risk of anxiety, depression, and cognitive decline. It may also raise the risk of stroke, especially in young adults. Second is the eye, nose, and mouth. Smoker has a higher risk of cataract and age-related blindness. Nasal irritation and loss of smell are common in tobacco users. Oral cancer, tooth decay, gum diseases, and bad breath are extremely common, especially with a gutka and khani user. Third is a throat and larynx, that is a voice box. Smokers often suffer from chronic hoarseness, throat infection, and laryngeal cancer. Many patients lose their ability to speak normally due to vocal cord damage or involvement. Fourth is the lung. The most well-known and deadly impact is on the lungs. Tobacco causes chronic bronchitis, emphysema, and lung cancer. Smoking are more vulnerable to asthma, TB, pneumonia, and COVID complications. Passive smoking also severely affects children's lungs. Fifth is the heart and blood vessels. Nicotine increases heart rate and blood pressure, putting strain on the heart. Smoking damages blood vessels leading to atherosclerosis, that is a clogged or blocked arteries. Increased risk of heart attack, stroke, and sudden cardiac death. Sixth is the digestive system. Increased risk of acid reflux, peptic ulcer, and pancreatic cancer. Smokeless tobacco causes esophageal and stomach cancer. Seventh is the liver and kidneys. Tobacco toxin burdens the liver, increasing the risk of cirrhosis and liver cancer. It also contributes to kidney damage and worsen existing diseases like diabetes. Eight is a reproductive and sexual health. Smoking reduces fertility in both men and women, causes erectile dysfunction, low serum count, and menstrual irregularities. Tobacco during pregnancy leads to miscarriage, low birth weight, birth defect, and stillbirth. Skin and bones. 9. Tobacco accelerates skin aging, wrinkle, and skin cancer. Weaken bones leading to osteoporosis and fracture, especially in a woman. 10th is the legs, feet, and extremities. Damaged blood vessel can cause numbness, pain, and limb amputation due to poor circulation. A condition called Buerger's disease. This affects many young tobacco users, especially those who chew or smoke heavily. 11 is the immune system. Tobacco weakens immunity, making the body vulnerable to infection, slow healing, and reduce vaccine response. TB, flu, pneumonia, and even oral ulcer heals lower in tobacco user. So to conclude, one body, one life, don't let tobacco destroy it from head to toe. Tobacco leaves no part untouched. It doesn't just take your health, it steals your breath, your voice, your joy, and your future. Every cigarette, every pinch of hookah, every puff of hookah takes something away from your body. The earlier we understand this, the sooner we can stop this self-harm. Self-harm. In the next lecture, we will talk about how tobacco affects the adolescent, brain and mental health. Until then, stay healthy, stay tobacco free and inspire others to quit. Thank you.